Hi, my name is Mr. Sainadin. I'm a consultant oral and maxillofacial surgeon at Manchester Royal Infirmary. I have a special interest in head and neck cancer and reconstructive surgery. I'm here today to talk to you about how we can help you manage the transition between treatment and cancer survivorship. We know that this is not easy for you, but we are here to take you through this journey as seamlessly as possible. The Health and Cancer Wellbeing Clinics are one part of the National Cancer Survivorship Initiative aimed at delivering high-quality ongoing cancer care. So, most patients who had a diagnosis of cancer are worried about the future. It can be difficult for you to see where to go next and struggle getting back to normality. Not only do you have to deal with the effects of treatment, but there is always the fear of recurrence or the cancer coming back, and this can have a huge psychological impact. So what happens when your treatment has finished? I can quote from a cancer survivor. After treatment, you feel that there is a big black hole as all your support goes away suddenly and you feel abandoned. Now, let me assure you that this is not the case, and we are here to help you. The reason you feel this is maybe because you're not seeing the doctors or nurses at the hospital so frequently anymore. Maybe because of isolation or insecurity, you're seeing less of friends and family. Some of you may not be back to work yet. In these circumstances, talking to family or friends about your feelings may help, or speaking to your allocated cancer specialist nurse who should be accessible by phone or email, and they can help you. Uncertainty about the future is a common worry and can be intrusive, making you feel as if you cannot plan for the future or enjoy life. This often gets better with time, but simple steps such as taking control of your lifestyle and having an organization and structure in your day may improve this too. Setting achievable and realistic goals can be helpful for some people. Negative feelings and anger are a normal part of dealing with your cancer. Everyone will have some bad days when they feel low or depressed. No one can be positive all the time. Talking about how you're feeling can be a positive response and helps you acknowledge how you feel and deal with it. Feeling tired, sad, and down after treatment is normal, but for some people, these feelings do not improve, and they unfortunately end up having depression. If you think this could be you, please talk to your doctor or nurse, as there are treatments that can be done to help you. We realize that many of you could be worried about your future. You may find it difficult to see where to go next and struggle getting back to a sense of normality. Not only do you have to deal with the effects of treatment, but there is always the fear of recurrence, and this can have a huge psychological impact. So, how do we try and reassure you, and how do we look after you? Well, regular follow-ups is key. This involves checking up frequently on your symptoms and concerns, carrying out clinical examinations, and appropriate investigations as necessary. Some patients will get a post-treatment scan, and some cancers need periodic imaging, whereas others don't. This will depend on your circumstances, the type and stage of cancer, and the treatment that you received. If you have concerns, please discuss this with your doctor or cancer nurse specialist who can explain the reasons behind the way that your follow-up is tailored. Regular follow-up also allows us to address treatment effects in the short, medium, and long term, and we can provide the required support. Initially, these are quite frequent for the first 1 to 2 years, and gradually the interval is increased. You will mainly be followed up in the treating MDT clinic, but some of you may opt to return to your local hospital, where you will be supported by the local clinician as well as the cancer nurse specialist, a speech therapist, and a dietitian. But initial follow-ups are generally carried out at the parent treating hospital where possible. Unfortunately, many of the symptoms of recurrence can be the same as treatment effects, and it is often difficult to tell the difference, sometimes even for us. So what do you need to look out for? Generally speaking, you need to be looking out for any lumps or ulcers in your mouth and neck, any change in your symptoms like pain or bleeding, any change in your voice and swallowing, or if you have a history of sudden weight loss over a short period of time. Please report your worries early, as it is better for us to have a look and reassure you rather than to leave it for late. Now, some of you would like to ask about how you could minimize the risk of getting it again. The best approach is to lead an active, healthy lifestyle and return to normality as soon as possible. For instance, going back to work. Also, I cannot stress this enough, but reduce your risk factors. Stop smoking if you haven't already, and only have alcohol in moderation. We can help you with treating the cancer, but you need to help yourself to prevent it from coming back. You also need to take ownership of your care and well-being. Thank you.